Hi, it's Dr. Elisha Van Duzen with New Hope Chiropractic. What are some common shoulder conditions and what causes them? What's at the root of them? That's a question I get asked a lot in my practice. Number one is osteoarthritis. It's really the most common type of arthritis. It's diagnosed when the cartilage that protects your joints and your shoulder joint degenerates or wears down. The chronic pain caused by osteoarthritis is often worse at night, and then the joints can creak or click because of the loss of cushioning from the cartilage. In addition to stiffness and weakness, the joint might appear swollen too. And causes typically are linked to long-term wear and tear of the joints. Traumatic injuries that damage the cartilage can also be linked to this condition. But also just a joint being out of position, out of its normal operating position for long periods of time, that can cause osteoarthritis too. It's kind of like a car with really bad front end alignment. The tires are going to wear unevenly, and as a result of that, you're going to have problems further on down the road, quite literally, with tires wobbling and not behaving and functioning the way they should, and you could have a blowout even later on down the line. So the same thing can happen with your shoulder too if it's not properly aligned. So that's where chiropractic comes in, because chiropractic can make sure that the joint is properly aligned and make sure it's tracking properly, and that'll ensure that it doesn't wear out prematurely, and you can have a shoulder joint as long as possible without having expensive or troublesome surgery that oftentimes won't work. It's by no means a magic bullet. So chiropractic can definitely be very, very helpful for osteoarthritis in the shoulder. Next is rotator cuff damage. That's another common issue and cause of shoulder pain. And the group of 4 muscles and tendons that connect the arm to the shoulder comprise this rotator cuff. And these tendons are susceptible to inflammation and bruising, leading to pain when performing overhead activities or sleeping on the affected side or reaching behind your back. And left untreated, these injuries can cause persistent shoulder pain. It gets worse and worse and worse. So typically here, repetitive stress and trauma is the main cause of rotator cuff damage. Chiropractic can lessen the length of time that the shoulder is hurting by making sure those muscles and ligaments track properly and the joint function properly, and with the joint being in alignment, then those muscles and ligaments aren't going to be overworking, and they're not going to be stressed, and then they're not going to wear out and tear as readily or at all, thus making it possible to use your shoulder without pain and suffering, and also not necessitating a surgery down the line. So very, very effective for rotator cuff damage. So next is bursitis. That's also another common cause of shoulder pain. A diagnosis of bursitis means there's inflammation of the bursa, which is a tissue-thin sac of fluid that cushions the bones, tendons, and muscles in a joint. And it reduces friction and absorbs shock when the joint moves, and it can cause a dull ache that worsens with movements of the arm upward or to the side or away from the body. The cause here typically is repetitive motion again, especially overhead reaching that's repetitive, from sports like basketball or swimming, and that irritates the bursa and causes inflammation. And again, if the joint is properly aligned and properly treated, so it doesn't cause pressure on this bursa, it's likely not to get inflamed, and that'll decrease the amount of pain or hopefully eliminate it completely. So these are some ways the shoulder can start hurting, and also some treatments for those issues as well. Check us out at New Hope Chiropractic, and have a healthy day.